So without further ado, I'll hand over to Paul. Thank you.
Thank you, everyone, and thank you for having me here today. I'm Paul Chandler. I lead NHS England's Net Zero Travel and Transport team. I'm going to go at a fair old lick today, so if you've got any questions or comments or would like to know more, please contact me at that shared mailbox, england.nztt@nhs.net. I'm going to try and cover quite a few things in about 20 minutes today, just exploring some of the work that my team are doing in a range of areas in travel and transport. Firstly, I'll talk about the scale and scope of the challenge that we've got to get down to net zero by 2045. Then talk a bit about the quite complex work we've been doing on decarbonising emergency fleets, and then move on to talk about hospital trust fleets, business travel, and then finally ending up with staff commuting. So firstly, the scale of the problem. Travel and transport in the NHS accounts for quite a lot of carbon, 4.3 million tonnes in fact in 2019. We're just about to publish an update of that carbon footprint in 2022, but it's not quite ready yet, so I won't say any more on that. But 4.3 million tonnes, and you can see that broken down into a number of categories here today. Today I'm going to focus on those first three on the left: fleet, business travel, and staff commuting. And that's partly because we just don't have great data at the moment in NHS England or elsewhere on patient travel, visitor travel, or freight transport. That's gaps in our understanding that we will need to fill pretty quickly over the next year or two. I'll start with emergency ambulances, and this is probably our biggest challenge from a technological point of view. Emergency ambulances are possibly the most difficult terrestrial vehicle to move to zero emission alternatives for a range of reasons. Firstly, they're very heavy specialist vehicles, which makes them very difficult to power the traction battery, but they've also got a lot of equipment in the back that needs power as well. Not just the clinical equipment, but heating, ventilation, cooling. Quite often those systems are on pretty much continuously at certain points in the year, and they consume a lot of power, so we need to think about that as well. Some ambulances stay within quite defined city limits, for example, but many of them cover a massive rural hinterland. If you think about parts of Cumbria, Cotswolds, Yorkshire, a single ambulance could cover a massive patch, which makes refuelling that ambulance more tricky to do. And obviously an ambulance needs to be ready for the next call. You can't say, sorry, can you wait an hour while I charge the vehicle up? So we need to refuel those vehicles whilst they're stopped for other reasons, so that they're good to go for the next call in the same way that petrol or diesel ambulances are. There's loads of other challenges I could talk about, but they're some of the key ones to give you a flavour. We've taken a data-led approach to this. It's a very high stakes process to go through. We have to get to net zero, but we've got to do it in a careful and data-led way. So we've taken four step processes. Firstly, we've used telematics data. Most ambulances in England are fitted with very sophisticated telematics systems, so we can tell how many miles they've done, where they've gone, when the ignition is on or off, how often they've used the blue lights, how often the defib is on. Lots and lots of data, millions and millions of lines worth of data that tells us what those vehicles do and how much. We've then worked with expert partners to convert those duty cycles into electrical energy consumption, not just to drive the vehicle, but also to power all that equipment in the back. So we know how much energy those ambulances are going to consume in a 24-hour period. I'll show you some data on that in a moment. We've then looked at the way that zero-emission vehicles are developing, both now and in the near future. Will that vehicle technology actually exist to be able to solve the problems that we've got with emergency ambulances? And then we've taken quite a detailed look at the refuelling infrastructure. How big, where, how much is it going to cost? I'll share some highlights with you today. Firstly, this telematics data shows annual mileages. Each one of those groups of data is for one of the 10 ambulance trusts in England. The bars are mean averages, annual mileage, and the dots are 95th percentile. Apart from London on the right-hand side, which does far fewer miles than anyone else, most ambulance services have quite a similar pattern of mileage distribution, both annually and when you drill into the day-by-day data. They are remarkably similar. So this myth that some ambulances do hundreds of miles every day, whilst it is not actually borne out by the data. Some ambulances might do this on occasion, and we have to plan for that. But by and large, it's quite predictable what an ambulance is going to do each day, each week. That's 92 miles per day on average. That's the mean average of every ambulance day in England. And the 95th percentile is 186 miles a day. So only 5% of ambulance days exceed 186 miles a day. Yes, we do need to think about those really long duty ambulances, but using the Pareto principle, we'll focus on delivering ambulances that can do 186 miles in a day. So we're developing quite quickly here. In fact, the NHS is leading the world in electric ambulances. West Midlands Ambulance Service developed this on their own in 2020. It was a diesel ambulance that they retrofitted into an electric one. Many of you will be familiar with this vehicle. It can do 120 miles on a single charge, so easily comfortable to do the duty cycles it's called to do. But it's got very bespoke electronic systems on there to allow it to have that high range. It's a very, very expensive ambulance. It's not really a viable solution for the 4,500 ambulances we've got in the NHS in England. We are now at NHS England leading a process where we're building 13 second generation electric ambulances, which will be ready this year. They are built on an electric van chassis, so are much, much cheaper to build. They've got lower range, 90 miles on a single charge, but that will be adequate for most ambulance duty cycles in which it's going to be deployed. In fact, that graph on the left will show you that 68 kilowatt, that bar on the left of the graph, that kind of ambulance would be suitable for over 80% of ambulance days in England, providing that we build the right refuelling infrastructure in the right places, and that will be the key. In terms of the future, by the end of the decade, probably much sooner, we'll be able to build ambulances with a bigger battery and much more sophisticated components that will give us 200 miles on a single charge. That's miles with all the equipment going as well, so it's operational miles, which will be enough for the vast majority of ambulances. So the technology is there to decarbonise ambulances on the pathway that we've set out. We also need to think about refuelling infrastructure. We've taken a very sophisticated way of doing this using the telematics data as well. We can tell how much energy an ambulance is used between every stop at an ambulance station or an ED. We've used that to calculate what refuelling infrastructure we will need and where. And there were a few surprises, really. Firstly, ambulances will only use a fraction of their battery between every stop at an ambulance station and an ED, which means they won't have to stop a charge every time they stop. They could charge maybe once every 12-hour shift. In fact, we've calculated that if an ambulance can charge once every 30 or 45 minutes every 12-hour shift, then this becomes a viable situation. And most ambulances, of course, are stopped for more than that. Your average meal break in the shift is 45 minutes on its own. So plenty of opportunity to refuel these ambulances to the needs that they need to. The cost of the hardware and the infrastructure is going to be about 65 million, which is quite a big number, but spread over 10 years or more, spread over 42 ICBs, it's not a ridiculous number. That does not include costs to reinforce the grid or DNO connections, wiring, etc. We think that might double the cost to 130 million, but still well within the means of the NHS to provide that refuelling infrastructure for those emergency ambulances. The NHS will save money overall by moving to electric ambulances because of the fuel savings and the maintenance savings that each ambulance offers. All right, it's not just about double crewed ambulances though. Ambulance services have a number of other emergency vehicles as well. We're trialling 21 of those up and down the country as well, and it's been wildly successful so far. In fact, Ambulance Trust love the electric vehicles. They've got so much that when we went to commission 90 new mental health ambulances nationally earlier in the year, the Ambulance Trust themselves requested that over 70% of those are pure battery electric. Once they've got experience of using these vehicles, they've deployed them, they've used them, they start to become the default option. London bought 80 zero-emission clinical vehicles, North West following suit as well. This will soon become the default option for clinical response vehicles in the next 2 or 3 years, and for ambulances by 2030, if not sooner. Of course, it's not just about the vehicle, it's not just about the refuelling infrastructure, there's loads of other operational things we need to think about. I won't go into those today, but it's just to say we're developing a very coherent, detailed plan with ambulance services about how we might tackle all of those things. In terms of the secondary care fleet, then the cars and vans that hospital trusts own, this will be quite a straightforward job by comparison. The NHS has 14,500 vehicles that it owns or leases outside the ambulance fleet. That's the second largest fleet in the UK after the Royal Mail. But only 4% of those vehicles are larger than a 3.5 tonne van. Most of them are cars, SUVs, like commercial vehicles. And there's a whole range of very effective electric vehicles out there now that could replace these kinds of vehicles. They are more expensive at the moment, but by 2027, 2028, most experts imagine those electric vehicles will be cheaper to buy or lease than the diesel equivalent. So it's not a question of when or why, it's a question of how quickly we can do this. In terms of what these vehicles do, the mileage distribution is actually pretty low. Over half of the vehicles owned by hospitals do less than 150 miles a week, and some of them do much, much less than 150 miles a week. In fact, only 5% of vehicles do more than 96 miles a day. So again, these electric vehicles often have ranges of 250, 300 miles on a single charge. Absolutely suitable to replace these vehicles. Now, and most trusts have 32 or fewer vehicles, so it's not going to be a massive financial commitment for over half of those trusts. It's a fairly straightforward swap out process. The vehicles are available to recharge for over 12 hours a day, typically overnight, which means that you won't need heavy duty charges. You probably won't need to reinforce your grid or your electrical circuitry. It's quite a straightforward swap for secondary vehicles. Business travel. This is a different kettle of fish altogether. We've collected business travel data last year and we've collected it this year, which we're crunching up at the moment. We collect it from the expenses system. So if an NHS member of staff has claimed for mileage or a train ticket through the NHS expenses system, we've got that data and we can crunch it up. And what the data tells us, probably unsurprisingly, that almost all of those journeys are entirely car-based. This donut chart on the right-hand side shows emissions, total carbon emissions by transport mode. So it's not total number of journeys or total number of miles. We've converted it into emissions. Nearly a third of those emissions are through those vehicles that the NHS own and operate themselves, which I've just talked about, cars and vans that we could fairly easily swap to electric over the next few years. Nearly 2/3 are what was conducted in what we call grey fleet. They are NHS staff using their own vehicles to conduct business travel. It might be a consultant travelling between hospitals for clinical duties. It might be a district nurse going out and visiting a dozen patients a day in their car. That's going to be a much tougher nut to crack because we obviously don't have control over what vehicles are used there. And 5% of emissions are from taxis. Only 2% of total business travel emissions combined are from rail and bus, which is a demonstration both of how rarely buses and trains are used for NHS business travel and also their lower emission per passenger kilometre compared to those other means, ultimately. Ultimately, all of that will need to get down to net zero carbon emissions by 2045. So within 2040, actually. So within a single generation, we're going to have to change the whole way that NHS staff travel for business purposes. It's a big job, about 242 million miles done on behalf of the NHS in business travel each year, and over 95,000 individual vehicles. What we found when we crunched up the data is we've got lots and lots of vehicles, usually pretty old, usually petrol or diesel, usually single occupancy, all doing tiny mileages each. There might be some better options for people, not just from a sustainability and emissions point of view, but from a time, cost and convenience point of view as well. So our strategy was three-pronged really. Firstly, eliminating unnecessary travel where that's possible through design of job plans, through telematics and telemedicine and remote working, and all of those things have already made some biggie runs there. Can we replace some of those short journeys with sustainable alternatives, e-bikes, shuttle buses, those kind of options? Half of business travellers do less than 12 miles a week, so can we swap those out with more sustainable alternatives? And where people do need a motor vehicle for business travel, can we support them to access EVs, possibly through salary sacrifice schemes, pool cars, etc.? There's lots of examples. It's a big job to tackle, but there's lots of successful examples. I'm just going to touch on a couple today. Leicester run a very successful shuttle bus between their three main hospitals and other points in the city. The bus runs at every 20 minutes at peak time, so it's a pretty regular and scheduled service. NHS staff travel for free. Partner organisations such as the universities, colleges, social care can access that bus, and they ride for free, and their organisation are billed to subsidise the cost, and the public can pay a really small fee. I think it's less than £1 a journey to travel on that bus. The buses are fully electric now, which is great, so they're completely zero emission at the tailpipe. And whilst the trust does pay money, it does cost the trust money to run this bus service. It's not covered by the fares paid. It's much, much cheaper for the trust to run this bus service than what they were paying for staff to travel between their three hospital sites in their own cars or in taxis. It's much more cost effective. So this is an example of how you might reduce emissions, make things more convenient for staff, patients and visitors, and reduce your financial envelope in the same time. Another example is using pool cars, where you provide that car for NHS staff to use for their own business so that they don't have to use their own car. It opens up jobs for people who might not own their own car, and it means that you can move to electric vehicles en masse and get a really good utilisation of those vehicles. Norfolk Community Pool Cars are able to reduce their total fleet size by 30% by a new approach to pool cars, and their pool cars are now used 60% of the time during working hours. So they're really well utilised, and they are moving to a fully electric fleet as well. So these things are all possible. There's some great examples of this happening up and down the NHS. I'll finish on staff commuting. Famously, the NHS is the largest employer in the UK, around 1.5 million staff. In most towns and a lot of cities in the UK, the NHS is the #1 employer there. And they're also the #1 trip attractor, because so many patients and visitors visit hospitals and GP practices in the NHS. So it's a huge consumer and creator of travel and transport. Nationally, from some data that we collected from a sample of only about 40,000 NHS staff, so not a huge sample but indicative, 66% of staff reported travelling to work on their own in a car, a vast majority of them being petrol or diesel cars. When you take London out of that equation, that figure rose to 74%. So 3/4 of NHS staff are all driving to hospital in their own car on their own, and then needing a place to park when they get there as well. We're really going to have to shift the dial on this if we're going to meet net zero travel and transport emissions. Sure, lots of people will move to electric cars by 2040, but not everyone will. And even if they do, we're going to run out of car parking spaces. Our air is going to be filthy. There's going to be congestion and stress. So we do need to shift the dial on this. What are NHS England doing about it? Well, we've set up the first modal shift network in the UK, the UK's largest modal shift network, called Step Up a Gear. Over 50 individual trusts, so about a quarter of the total of NHS trusts are involved in the network in some way, shape or form. And the network is really focused on developing, refining and sharing best practice interventions in terms of supporting NHS staff to commute in a more sustainable fashion. We've built an evaluation framework bespoke to each individual intervention, so we can tell how successful each intervention is over time, and can then start working out why an intervention might be successful in Leicester but not in London, and start to work out the factors that make these interventions successful and how we might tweak them to local circumstances to make them really effective. Focused on 4 themes, as you might expect: active travel, public transport, car parking and data and technology. And there have been some fantastic early results. Hull is a bit of our poster child. They conducted a staff survey in spring 2022, introduced a range of measures, and then surveyed the staff again in 2023, a year later. 13.5% reduction in the proportion of staff travelling in single occupancy cars, with a corresponding increase in local bus services and a corresponding increase in bikes and e-bike usage. It's a package of measures. It wasn't one single thing, but it shows that if you listen to your staff, you survey them, you respond to what they want to see, you provide them better, cheaper, more convenient, more reliable alternatives, you can really make a massive difference. Birmingham doing something similar, offering all of their new starters a month's free bus pass that's funded entirely by the bus operator, not by the trust. 55% of people that started using that free bus pass have now become regular commuters by bus. It just shows if you get people early, before they've formed commuting habits, you can have a big impact. So there's loads and loads to do. It's a massive job, but there's some green shoots here in the NHS, and lots of things led on the NHS front line that can be successful elsewhere in the NHS, could be successful for patients and visitors as well, and could be successful, crucially, for other employers up and down the country. I think that's all I wanted to say today. Thank you for listening.